when it does that, I can't step down a little. Hi, my name is Jacqueline, and I'm going to be doing the musculoskeletal exam. And this is Twyla. This is going to be my patient. We're going to look at her hands, her arms, flex and extension. We're going to be looking at the shapes of her joints, and we're looking for any redness, swelling, so pain. So what I'm going to do is I'm going to start out with her triceps. So we're going to extend them, and these are her triceps right here. And then we can look at her biceps, and then we're going to flex it. You let me know if there's any pain. Then we're going to look at her fingers. And you can turn your head over. And then we're looking at the ulnar and the radial. And then there is an exam called the tenno exam. And that exam will either use the hammer, or I could use my middle finger and just go right here on the nerve and just tap it, and I should get a reflex. And then we want to put up both hands. We want to look at the shapes of her hands. That's okay. And just make sure they're symmetric, and that means that there's no joints. They're shaped in a normal fashion. And then you want to look at her fingernails. And since she has on nail polish, I'm just checking to make sure she got good capillary refills. And then the range of motion. Are you able to do this? Yes. No joint pain? No. Then we'll look at, we already did your wrist. Yeah. So are you able to take your wrist and go around like this? Yeah. And the other way? So I already looked at your metatarsals. And another test we could do is the Phelan test. And that test is for the flex of the wrist to a 90 degree to maintain at least for 40 to 60 seconds. Okay. And then we'll look at her shoulders. And with the shoulders, first I'm just going to like palpitate them. And then here's your clavicle right here. And we got this is the superior clavicle, and this is the inferior clavicle. And we're looking to see if there's any fractures, any pain, any swelling, any dislocations. It will take your arm, it will raise it up over your head and go back. We'll take it and go backwards. Is that painful? Sorry.
No. I can stretch that part.
So you can take your arm, you can take it back behind your back. Yeah. And then feel in her clavicle, her scapula. Also, I forgot to look at the ulnar, and so I mean the old cranial. And so what I'm doing is I'm just feeling the joint itself. And again, for deformities, swelling, redness, any dislocations, discomfort, any nodules, any joint symmetry, and any muscle atrophy. Okay. And the same things occurs with her shoulders too. The joint atrophy, I mean the muscle atrophy, the joint dislocation, the swelling, the redness, the deformity. It's such a long list. So we have you clap your hands behind your head and extend your arms. And this allow the elbows to be parallel to the front. To the front. Okay. And put your hands this way. Yeah. Okay. And with your hands on this side. What we call this is abduct. That means pull them apart 90 degrees. And then adduct. That means bring them to your side. You might want to stand up. So there we are. Can you bring it up to the middle of your back?
Okay.
And so we're going to look at doing the, so in these joints right here, the acronocranial joint, we want to look, we want to check it out for tenderness, for fluid. So then we're going to do like that. The Hopkins impingement. I'll take gently and firmly do the activity rotation. This would be interior. And then exterior. I'm not sure. So then we're gonna look at the head and the neck. And with the head, I'm looking to make sure her head is shaped in the right form. And also I could be feeling for any lumps, any dents. So we're gonna look at your cervical spine. And the cervical spinal is in the lower part of the neck and the top of the back. And could you take your head and put it down to your chin? Your chin down. Your chin down to your chest. I'm sorry. And then you take your neck and you could go from lean it to left and then over to the right as far as you could go. Okay. So what about turning your head this way and the other way? And then we'll look at your, and then give you 2 fingers. Then open your mouth and close it. Open it, close it. Okay. So then I'm gonna have do the empty can. And so I'll have you stand up, and then you take your arms and flex out this way, bringing them up. And then let them down. And so there we're looking at this super final. And then we're gonna have you to abduct your shoulders 30 degrees. Let's see. So, and then we'll do the resistance. We'll have you sit down. So I'm gonna push against you. You're gonna push toward me. Making sure your pulse intact. So when you're at a 70 degrees, I'm gonna be looking at your deltoid. So we're gonna have you stand up again, and we're gonna do the inferior spinesthus and the teresi minor. So you take your hands, we'll turn this way, and you just relax your hands, And I'm going to take them and put them like this. And push your arms toward the rotation, right? And so this part right here, we'd be trying to look at the clavicle in the back. Put your hands outside of it. So you bend them this way, and you put them outside of your forearms. Okay. And then I'm gonna push against for resistance. Okay. Push hard. Okay. So with the Hawkins impingement, it goes like this. I think I did that one. And then I'm gonna have you stand, stand, turn this way and stand. And then what I'm gonna be doing is I'm gonna be checking out her legs. Stand back a little bit. And with her legs, we're trying to see if they're both equal. And so we're looking at the knees, and we're going to palpitate the knees to make sure there's no swelling or dislocation in the patella. And they should seem to be shaped even and no edema. And then I'm going to pause for a minute so I can help her get on the bed. So now I have my patient on the bed. So now I'm going to check out her hip reflex. So I'm going to take her leg, I'm going to bend it up. And so when we do this, we're looking to make sure there's no hip dislocation. And then we'll stretch it out. Let's do the other one. You have to check both hips. Any pain, any swelling. And then we're gonna look at her legs, and then when we do her knees, then we do first I'm gonna lift her leg up. I'm just feeling under her patella. Then we'll raise it up. So I'm just doing a flex and a extension. And then we do a flex and extension and hold your leg. You can. So we're gonna look at doing like a little rotation. So we'll take it and we'll turn your foot inward. Roll it and turn your foot in. So I'm also checking out her knees. Then I'm gonna take and push your foot down. Bring it in. And it's just checking out the joints. Then we'll look at her ankles. I'm just like feeling the ankles along the sides of them. Any swelling, pain, dislocations, nodules. So we're looking at the rotations now. Rotate. Let's let me do it. Take your foot this way and this way. And point your toes down and up and down. And then in order to check for the length of her legs, we would take a measuring tape and we would just measure like from her inner thigh all the way down to her foot to make sure that they are both the same size, same length. So I had her to sit on the side of the bed. So we're just gonna do like the wrist flex and extension, and then we'll do the elbow flex, the flex and extend, and flex and extend, and the shoulders will flex and extend. Mhm. And then for the hips, I have her sitting on the side of the bed, and then she's gonna take her leg. We're gonna take her leg and extend it and let it down. Extend. And so then we'll do the hip abduction. Abduction is you open your legs, spread them apart. Just leave your knees bent and just open your legs. Now close them, and that's adduction. And then for your knees, we're gonna extend, extend. Then we're going to do the planters and dorsal extend and flex. So with the dorsey, it's on the back of her, over here at the back of her heel. So that would be right here at the back of her heel, back here in this area. So we have it extend and flex, extend. And we'll do the same for the left one. We're going to relax. We're going to flex and extend. So we're going to look at the meniscus or meniscal injury. And so you slightly bend the knee. I got you. Got you. Just relax. You slightly bend the knee, and then you find the joint space along the lateral and the medial. Be right in here. And down the tibia. So you're looking for injuries, and of course, swelling and redness, pain. For meniscus injury is you would take and bend her knee back this way and tilt her foot outward like this. Lightly bend it, tilt it out. No, keep your knee straight. Tilt it outward. Now that's another way you'll test for meniscus injuries. And like when I lift this, if there was a meniscus injury, I would hear a click with the hand on the knee. It would be like this. So right here, I would hear if there was a injury that I would hear a click right here. Okay, I want to go back and do the empty can test again. So she would stand straight, and then she would put her arms at a 90 degrees angle and turn her thumbs downward. I'm going to put pressure to resist her from bringing her shoulders down, and that is the empty nest test. So if there was any pain, she would feel pain on the side that was injured, and that's for impingement. Okay, I'm going to do the Apley's meniscus test. And what I have to do is I have the patient laying prone, and I'm going to take my knee and I'm going to put it on the bending of her knee, and I'm going to flex her knee up, and then I'm going to take her foot and I'm going to turn it inward, rotating it inward and outward. So if it's inward, it will be a medial tear, and then if it was outward, it will be a lateral tear of her meniscus. And another test, I'm just trying to repeat some of the tests because I was trying to get them right. So this is the nearest Hawkins test. So what you would do is you would just do a full passion motion. So I'm going to take care of your arm, okay? And then I'm going to watch her face to see if there's any pain. So that would tell me if I saw uh, pain on her face or a facial expression as she had pain, then I would know that she had like an impingement. But also, I could just ask her, is that pain what you brought you here today? And then, like for the Hawkins, it would go at an angle, 90-degree angle, with her shoulder and also with her hand. And then you just okay. And you also detect the same. And that is my musculoskeletal physical assessment. Bye. Okay, so I just wanted, there's a couple of specialties that I forgot to put in the earlier video. So I wanted to do the Yerkes test. And so what happens is I'm going to have her put her arm at a 90 degrees close to her side, and I'm going to feel on her biceps. And if the biceps should pop out of the groove, then that's a positive test. So you're going to resist me, and I'm going to, okay, resist. And you can feel it right here in the groove. Okay. Okay, so we're going to do the Lachman's test. And so with the Lachman test, I'm going to have her to help, well, I'm going to put her knee up to 20 to 30 degrees. And then I'm going to go ahead and grasp up under her, the, the proximal tibia, and also on the femur. And on this test, I'm looking for a dislocation, so I'm going to be pushing up on it and feeling at the same time. And for the amount of anterior displacement, and with the increase of displacement or soft end, that is positive for ACL injury. Okay, so the next test is going to be the Morton's neuroma test. And that test is, so it's diagnosed between the third and the fourth um, metatarsal, in between the toes. And what it is it's a fiber, and it could be, what usually happens is the patient has numbness, tingling, it's difficult to walk. What they usually do is go in between the third and the fourth toe, cut a little slit, and take it out from the bottom of the foot. Okay. Okay. And another thing I wanted to do was check out the spine. So you would be looking for any curves in her back. Is that straight? Shoulders. Can you put your hands back like that? And you're also checking out the trapeze. Okay. Right. Okay, I'm gonna perform the Phelan's test. And with the Phelan's test, I'm gonna have you take your hands and turn them inward, bring them up, press them together for 1 minute. And what the Phelan test is done for is carpal tunnel. So if the patient complains of numbness or tingling in the index finger, the thumb, the middle finger at the tip, then that's positive for carpal tunnel. Okay, the next test I'm going to perform is the neuroma test. And that test has to do with, I have to take, and I'm going to be at the foot of the bed. So what I'm going to do is I'm going to, between the third and the fourth metatarsal, I'm going to also put my thumb up under the ball of the foot, up under the third and the fourth. And what I'm going to do is kind of just feel around. And if I felt like a ball in there, nerve pain, or patient has numbness, tingling, or a nerve type of pain, then that would be positive for a neuroma. And they're usually surgical removed. Okay.